Hi, everyone. I'm delighted to present this study on behalf of the lead author, Scott Small, and the study team. So in terms of background, as we know, in our increasingly warming world, the need for adaptation planning and health systems is more urgent now than ever. Yes, please. Yes. And then next again. So despite the increasing incidence of extreme weather events globally, there's an overall lack of understanding on the impact of hot weather on everyday physical activity and sleep. So just two of the fundamental determinants of physical and mental health. For instance, if and how should physical activity and intensity patterns be adjusted against the rapidly changing climate? Next, please. So in this study, we investigated the impact of outdoor temperature on physical activity and sleep, conducted a population-based retrospective cohort study using the UK Biobank. Machine learning derived physical activity and sleep duration were measured in more than 90,000 participants during a 2-year period from 2013 to 2015 using wrist-mounted research-grade activity accelerometers. Same day meteorological data from participant count was provided by the UK Met Office. The associations of temperature with daily aggregated mean step count, daily minutes of moderate to vigorous physical activity, overall acceleration, light activity, sedentary time spent, and time spent in sleeping were assessed. This was done using multivariable generalized linear regression adjusted for socio-demographic, clinical, lifestyle factors, as well as season and precipitation, and also by 4 UK regions. So a total of 90,434 participants aged between 43 and 78 years were included, half of whom were women. Overall, next please, across the range of temperatures observed during this period, from 5 degrees to 30 degrees Celsius, physical activity levels were lower for women, elderly, and those with high BMI. And marginally for those living in southeast of the country as compared to north and western regions of the UK, which are generally slightly colder. Next. Now, the relationship between temperature was not necessarily linear for the various measures of physical activity considered. For example, moderate to vigorous physical activity increased by 10 minutes per day from 5 to 25 degrees Celsius, but it did not increase further between 25 and 30 degrees. However, between 25 and 30 degrees, time spent in sedentary activity increased by 10 minutes on average. And so we can see the sort of inverse relationship between vigorous activity and sedentary activity with temperature. So what do these numbers mean? A reduction of physical activity of 10 minutes per day takes away about an hour or so from the WHO recommended 2 to 5 hours of physical activity that everybody should have. Next. In terms of sleep time, there was an increase in temperature was accompanied by a consistent reduction in sleep duration, where sleep was reduced by 39 minutes on average between 5 degrees and 30 degrees, amounting to a weekly drop in 4 to 5 hours of sleep per week. So some strengths and limitations, obviously, these data are from the UK, which is a traditionally temperate climate, as reflected by the temperature range of between 5 and 30 degrees. And that was observed. And as such, these data should be replicated in other regions, such as those with the highest heat and climate vulnerability indices around the world. Also, although precipitation was adjusted for more direct measures of experienced humidity should also be studied for better understanding of human wet bulb thresholds in actual practice conditions. And so these data, to sum up, suggest that changes in physical activity levels and sleep duration may be associated with elevated outdoor temperatures, even for those living in mild climates. And lack of physical activity, as we know, is a leading risk factor for mortality. So further investigation of these preliminary findings could contribute to climate adaptation planning for healthcare systems, such as updating WHO physical activity guidelines. Thank you very much.
Okay, thank you, Sarah. We will have time for maybe one question, one very burning question. Anyone? Okay, we have one over here. Dr. Shahrul?
I want us to Sarah. Okay. About the temperature data, I think from your study, you're using the outdoor data from meteorology department. But is it there's data for indoor from the devices that we use to see the effect? Because if the outdoor might be there's a bias of the influence effect to the sleep or any physical activity. But the indoor inside the house means there's another dimension of data that we can consider.
Yeah, completely agree. So this study looks at outdoor ambient temperature using meteorological data. And as suggested in the interpretation slide, the interaction with any indoor temperature as well as indoor other risk factors should also be studied and adjusted for as well in future work. There are some studies looking just at that. Thank you.
Thank you.
Thank you. One more question from the audience. Going once, twice. All right.
About the biosensor for the candida. Okay. Thank you for your presentation. It's really interesting work. I want to know that when you develop the biosensor for the detect some biomarker for candida or less, what type of the biosensor that you make, like a strip or something? I'm not sure.
Thank you very much. At the moment, we are still looking to putting in the laboratory base. That means it's still confined with the laboratory equipment, specifically real-time PCR, or maybe at least we want something that can be the probes or fluorescent detection that can be detected by analyzer that independent from any temperature. Meaning that the future will be a deviceless or point of care where you're not necessary to operate the reagent in the laboratory, meaning that it can be the bedside. So, but the process and the research is still going on. So yeah, so that's the plan.
Thank you.
Thank you. Thank you so much. That brings us to the end. I would like to thank you for your patience with us through our technical difficulties. And also, I apologize for my strict timekeeping, but I think that got us to complete on time and everyone got to present. So I'm happy about that. And I believe this is a start of discourse that's just going to continue throughout the conference. So thank you for your time and I wish you a happy conference.